Hello, my name's Claire. I'm a paediatric oncology aftercare nurse at Bristol Children's Hospital. So I look after any child who has had childhood cancer and look after them through their teens, into their 20s, 30s, 40s, and sort of educate and support them for late effects of their treatment. So Karen's asked me to talk to you today because recently we have been dialing into joint clinics with the ALD team and the neurology team to try and provide some support for the ALD patients post bone marrow transplant and educate and support them for aftercare and late effects. So I'm just going to have a chat to you today about, hopefully, what good aftercare means. Okay. So the reason ALD patients have bone marrow transplant is to try and slow and halt the disease progression. So the lowest score is an ALD MRI score, which rates the severity of the white matter lesions. It ranges from normal, which is 0, to 34, which is abnormal. The MRIs are scored by 2 independent physicians who were blinded to the patient's previous neuropsychology test results. If the lowest score is greater than 8, the disease is more severe and unfortunately has a good hold in the brain. The damage can take time to show, and the bone marrow transplant takes 12 to 18 months to halt the disease and therefore the damage to the brain. So unfortunately, the disease can progress significantly post bone marrow transplant, and this just takes time to slow. Also, chemotherapy can make the disease worse. So post bone marrow transplant, you should expect really close follow-up from your local bone marrow transplant centre. Local services vary greatly across the country. No 2 centres are the same or work in the same way. In Bristol, patients are followed up closely for 2 years post BMT, and then will go into the bone marrow transplant long-term follow-up clinic. And this is also called aftercare. Follow-up is really important to monitor the late effects of treatment. So what is aftercare? So aftercare is about being a very supportive service. So we have a phone line and also an email address that people can contact us on. It's about signposting. So we won't help with new diagnoses, but we can signpost to the GP or to other relevant services so that the individual gets the help that they need in a timely manner. So liaising, we do a lot of liaising with other healthcare professionals. So I've been working closely with Karen with the ALD patients, and we would also work closely with the endocrine teams, cardiology, fertility, and so we have a lot of liaising with other healthcare providers. Also, health promotion. Health promotion is a real biggie because we know that if people can look after themselves and look after their bodies, their outcome's going to be better. So we do lots of health promotion, ideally in a non-patronising and supportive way. I've got 2 teenagers and they certainly don't like to be talked at. So it's about doing things in a way that's going to suit the individual. It's also really important for young people to understand the treatment that they've had. They're going to grow up, leave home, get their own GPs, and it's really important actually that they understand about the medications that they've had, the effects they can have, and the follow-up that they need to keep an eye on them and ensure they stay healthy. We also find it's really important to give this information at an age-appropriate time. So some 15-year-olds are really clued up, want to know everything, have lots of knowledge, and some 15-year-olds don't want to know anything at all. So it's for us about assessing what is the right time to give this information at the time we're ready to hear it. So late effects basically depend on the conditioning treatment that's been given for the bone marrow transplant. It depends on any pre-transplant medical problems. It depends on the age at transplant, and also if that individual's had any complications during the bone marrow transplant, for example, acute and chronic graft versus host disease. It can also depend on other drugs that are given during bone marrow transplant. So some children might have more antibiotics than others. They can have effects. So it really is, it's totally individual, and no 2 pathways are the same. So typical drugs used in bone marrow transplant for ALD. So there's a set of drugs that are used to prepare the body for transplant. I won't go through all the names, but these are the drugs I'm going to talk about more in a minute when it comes to late effects. And then also there's some drugs used to prevent graft rejection. Some of these may be familiar to you. So cyclophosphamide and busulfan can be very damaging to sperm production and therefore affect fertility. Testosterone production still happens. And we find it's really, really important to discuss this in clinic actually, because when people are having the bone marrow transplant talks, the family's whole focus is on, the lead up to bone marrow transplant, the transplant, getting through the transplant, everything being okay after the transplant. And so actually late effects are discussed at this time, but very few people actually take them in. So it's really important for us to discuss these in clinic because it might seem like new news to people. A standard thing that we would do would be refer to the GP for a sperm analysis. If possible, sperm is stored pre-BMT. And also there's new experimental treatments happening all the time really. So one of the recent ones is that testicular tissue is stored pre-BMT in the hope that in the future that'll be able to be used. It's really important as well to consider genetic counselling before this. So effects on heart and lungs. So cardiovascular disease can affect survivors who received high-dose cyclophosphamide. Also chronic graft versus host disease or significant infection can also affect lung health post-bone marrow transplant. So it's really important for us to discuss these risks with the patients and also plan for the tests that they need. So we tend to do echocardiograms, so an ultrasound of the heart, every 3 to 5 years following transplant. And this is to check that there's no damage immediately afterwards and also that there's no damage as they go on. Because if there's any change to the cardiac function, we will do a cardiology referral and it may well be the individuals need some medication to support with that. But the sooner we can detect that, the better. Also a lung function test, that's just checking the function of the lungs, just involves blowing into some tubes and checking the lung functions. That's again something we would check very regularly. The aim being to try and detect any changes early so we can act on it. Bone marrow transplant can affect the endocrine system, so affect your hormones. These can also be affected by the impact of ALD. Radiotherapy doesn't tend to be used with ALD patients. It's used very commonly with leukemia patients. But if radiotherapy is used for any reason, then additional tests are going to be needed to check for hormone function because the radiotherapy can affect a lot of your hormones. Osteopenia and osteoporosis, so chemotherapy and steroid use can affect bone health. Again, it depends what medications are given. And it's important to maintain, healthy bones. And your vitamin D levels also affect this too. So something to bear in mind after a bone marrow transplant is that to prevent acute transfusion-associated graft versus host disease, everybody who's had a BMT should have irradiated blood products until the following criteria are met. The exception to this is if a drug called fludarabine has been used for transplant, then irradiated blood product should be used for life. There's a blood product card, and everybody who's had a bone marrow transplant and needs irradiated blood should carry that around with them in case of an accident, in case they suddenly need to be given blood so that people have that awareness. So a bit like we would recommend people wear a Medilert bracelet. So risk of secondary cancers. Cancer can occur rarely after bone marrow transplant. Again, if you've had radiotherapy for preparation, that's got a greater risk than just having chemotherapy. This can cause significant anxiety to survivors and families, and health anxiety certainly is really common in the families, in the patients that we see. But actually, cancer is a common risk for all of us as we get older, and so it's about avoiding environmental risk factors, and that's another reason that healthy lifestyle education is really, really important. If somebody has had radiotherapy, we just advise to check for skin changes in the radiotherapy area. If somebody was concerned, we talk about having the lumps and bumps chat, so always check for any lumps or bumps or anything that's not right. We would advise seeing the GP for a route for rapid access back into the healthcare system, because the GPs can refer to the 2-week cancer pathway. So bearing that in mind, healthy lifestyle is absolutely key. The healthier that you can be, so we obviously try and recommend a healthy diet with regular exercise. And again, when we're discussing all of this, we're not going to sit and talk and lecture teenagers, young people, because, they don't want to hear it. It's going to be just about planting that seed as young as you can and just empowering them to live as healthy a lifestyle as they can. So we talk about the importance of healthy diet, regular exercise, but also exercise for your psychological health, like yoga or Pilates, trying to keep as mentally strong as you can. Using sunscreen's a biggie, particularly if you've had radiotherapy. Everybody should wear sunscreen. I'm a huge advocate. You can't see me closely, but I'm like a giant walking freckle. So, I don't go out without my factor 30, and it's the one thing that we can really do to protect our skin from the harmful UV rays. Obviously, being a non-smoker, we know that smoking is a major risk factor. Not taking drugs, and also we're not going to lecture on not drinking alcohol because that's not realistic. It's about safe alcohol consumption as per government guidelines. It's just about being as healthy as you can realistically and knowing your own body and checking for any changes, really. So the summary being, it's about instilling the importance of looking after the body to minimise future ill health. I'm so pleased that mental health is now talked about really, really openly. I think I've only seen a very small proportion of our patients in Aftercare who don't have some sort of mental health issue as a result of their previous treatment and diagnosis and the treatment that they've been through. We very commonly see people with anxiety, particularly health anxiety, worrying about, recurrence of symptoms or effects of their treatment, body image issues. A lot of our patients have a degree of disability, and this can cause depression. Also, even when children have been very small when they've been treated, they can still suffer from survivor's guilt, that they've survived and somebody who was also their age with the same diagnosis hadn't. So we see a huge amount of mental health issues. I've got a lot of email addresses or websites that I can put people in contact with if I'm really concerned. I'll also get our psychology team involved. We're very fortunate to have psychology input within the Aftercare team. And so very often I'll refer my patients to the psychologist so they can have a chat and then sort of support and signpost to counselling services as well. I actually think everybody in life should have counselling. I think it's really good to talk, and that's the main message we try and get across. That actually it's just talking to somebody. So whether that's a parent, a teacher, a friend, a nurse, a doctor, anybody, just as long as young people are talking to somebody, that's just really, really key. So when it comes to multidisciplinary follow-up, post bone marrow transplant for ALD, it's really important to have some sort of long-term follow-up to look for these late effects that we've talked about. So whether that's with your local bone marrow transplant team, your local oncologists, or if you're lucky enough to have an Aftercare team in your area, most of the big centres do around the UK. Also, having input from a neurologist, your ALD specialist, obviously, and if there are any hormone issues, seeing the endocrine team too. So I'm sorry I'm not here to be able to answer questions face to face. I do love answering questions usually. Please contact the centre where you had your BMT if this has raised any questions for you, or if you want to email Karen, she can forward any questions to me. But I hope this has been helpful, and thank you for listening.